It's time for answers to your medical questions. And get an inside look at the latest in healthcare, medical technology, and treatments. This is Rex on Call.
They just felt full and achy and heavy, you know, just like if I have to walk anywhere else tonight, I'll just crawl.
This local woman suffered from painful varicose veins, but after years of discomfort, she's found relief. Welcome to Rex on Call Live on WRAL. I'm Kim Dean Holderness for Rex Healthcare. It's far beyond a cosmetic annoyance. Varicose veins can be painful and an indicator of a more serious underlying problem. Today we'll be discussing vein health and new less invasive procedures. If you're watching us live now and you have questions concerning varicose veins, spider veins, vein disease symptoms and treatments, call us now with your questions. Your questions may be answered here live on our program by our experts. The experts answering your questions today are Dr. Bobby Mendes with Rex Vascular Surgical Specialist and Dr. Seth Weinreb with Rex Surgical Specialist. Both see patients with Rex Comprehensive Vein Center. To connect with us here at Rex on Call, just dial that number on your screen. In Wake County, 919-744-3876. And outside of Wake County, call us toll free, 877-277-6252. If you're watching us as we're streaming live on WRAL.com, you can even email us your questions. RexOnCall@RexHealth.com. You can even find us on Twitter. Lots of ways to get a hold of us today at Rex Healthcare, #RexOnCall. You may have varicose veins and not even know what causes them. See, in normal veins, valves keep the blood moving towards the heart. In varicose veins, those valves don't function properly, and blood stays in the veins, causing it to enlarge. And as Beth Leach is about to tell us, it can be downright painful, but now she's found the relief she's been waiting for.
You wouldn't know it to look at Beth Leach, but just a few years ago, she said the back of her legs looked like a road map of varicose veins.
They just felt full and achy and heavy. Like if I have to walk anywhere else tonight, I'll just crawl.
This 44-year-old mom of four first noticed varicose veins in her 20s.
My legs were achy and sore a lot, but I didn't pay attention to them. I was in nursing school, I was waiting tables, I had a house, I had kids.
She was so desperate about 15 years ago, she underwent a procedure called vein stripping.
Recovery was ridiculous, you know, bandaged legs for 5 weeks.
But she felt better until recently when those varicose veins reappeared, and so did the discomfort. Dr. David Powell, a physician with Rex Surgical Specialist who also treats patients at the Rex Comprehensive Vein Center, told her a new way of bringing relief, the venous closure procedure.
This is much more delicate. This is much more refined. We access the vein with a needle. After we do that, we put a small wire in it, an introducer, and then this small catheter, which is about the size of a pencil lead.
That heat closes the vein, and the patients like Beth feel almost immediate relief.
The recovery was completely different, you know, as opposed to bed rest for 5 weeks. I drove myself there. He did the procedure. It was over in 15 minutes, and I drove myself home.
Treatment of varicose veins is not a cosmetic issue. As Dr. Powell points out, our vein health can be an indicator of troubles in other places in our bodies.
Varicose veins and vein disease is an indication of a problem in a valve. That vein can be damaged either from a congenital, hereditary type problem, a blood clot. We always do ultrasound on our patients to make sure they don't have a blood clot and to actually evaluate the reflux or the backwards flow of the vein, and extensive evaluation to see exactly what's causing the varicose vein, what's causing the vein disease.
The Rex Comprehensive Vein Center specializes in non-invasive vein treatment, vascular surgery, cardiology, peripheral vascular diagnostics, and more. And now Beth is proud of her legs, but most of all, she loves the way she feels.
Then compared to now is night and day.
Joining us now are vascular doctors Bobby Mendes and Dr. Seth Weinreb with Rex Surgical Specialists. Both treat patients at Rex Comprehensive Vein Center. And quickly, just a little bit about the Rex Comprehensive Vein Center. A team of physicians works together for the best patient care, no matter how simple or complex the case. They're trained in the latest therapies and techniques. So whether treating small spider veins to the most complex peripheral vascular disease, they can offer the best options for the patients. So we are already getting a lot of questions in, so let's get started. This is from Pamela and Wilson, who was emailed varicose veins in both legs. In the left leg, it goes from the thigh just past the knee. It swells and feels like it's on fire. How can she stop the swelling and the pain? Dr. Mendes.
Sure, thank you, Kim. That's a typical type of presentation that patients will have with varicose veins and venous insufficiency. That is, they get the burning sensation, leg swelling. And most of the time, the best way to take care of it is, first of all, to try a non-surgical intervention. That is, good exercise, elevating their legs when they're not round, moving or walking, and then compression therapy with a good compression hose rated 20 to 30 millimeters of mercury. After you do that trial period to see if that's able to alleviate the issue, you then can evaluate them with an ultrasound, and if there is an underlying issue and they're not comfortable with the compression therapy, you can treat it surgically.
Okay, here's Anthony from Sanford, a 44-year-old male with varicose veins in his lower legs, and they're constantly achy. He's a truck driver, always on the road. How can he fix that?
Thank you, Kim. It's definitely a disadvantage to have an immobile lifestyle, no question about that. So addressing that lifestyle, if possible, with getting around, walking, especially hard for a truck driver, sort of in between legs of being on the road, to get out and walk around. But no question, for a patient like that, I think compression therapy is really, really important. Certain medications like non-steroidal anti-inflammatory drugs used sparingly will also be effective. But I would say for Anthony, what I would recommend is get in to see your physician. You need an ultrasound to see if there's an underlying problem that can be treated.
Okay, we actually got another email in from Donna, who has recently told the vein in her right leg wasn't working properly, and she honestly felt like the doctor was trying to just get her into this procedure. That's not a first step?
Well, not necessarily. That is a common situation where patients feel like they're being pressured into different types of procedures with the number of vein clinics that are being brought up and developed around the country. The best thing to understand, first of all, is that it's not limb-threatening. She's not going to lose her leg from this. She's not going to die from this. And the procedures that we're talking about here today are elective, but while elective, they can dramatically improve your lifestyle. So what the issues she has there, it's not absolutely necessary to have anything done, but a lot of times a procedure can make her feel a lot better.
But isn't there a way to tell in terms of what the comprehensive vein clinic does? I mean, even from a small problem to a more complex problem, what the actual problem is, and that's what you can give her some options?
Well, yes. Again, a very important part of this process is an ultrasound, a careful, thorough ultrasound to really look and see what the underlying problem is. If indeed this patient has documented reflux, then, like Dr. Mendes said, what we do is strive to try a non-operative management first with good high-quality compression therapy and really give it some time. Many patients do better with these treatments, and if not, then we talk about a surgical procedure, which would be an ablation procedure in the office.
Okay, and that's the one we saw at the beginning of our piece. Okay. We are right back after the break to answer your questions, and give us a call. The number's there on your screen. You can email us, find us on Twitter. We're getting a lot of phone calls. We're going to hope to get you some answers right after this break. Welcome back. This is Rex on Call live on WRAL. Today we are answering your questions on vein health. If you have questions for our experts, call in now. In Wake County, 919-744-3876. Outside of Wake County, toll free, 877-277-6252. Email us those questions. Find us on Twitter. Let's get to it. We're getting a lot of emailed questions and a lot about these surgical procedures. But can you describe these surgical options for us?
Sure. There is no set procedure that is best for the lower extremity for the veins. There are a lot of different options that are available, but probably the most common one that we perform is a simple needle access into the vein, done in the office with a little bit of Valium for comfort. And the patient, as you heard earlier on in the show, is able to go home after about 15-20 minutes of a procedure being performed. And while it's still called a surgical procedure, it's minimally invasive and oftentimes is much less painful than a simple IV placement.
But before you get to that process, we've talked about the compression therapy. You're actually wearing stockings now, Dr. Weinreb?
Indeed, Kim, I am.
Is this for your own vein issue or just because you like wearing them?
Well, I mean, sometimes people think that it's a problem, a disease they have, but really a lot of patients complain of swelling as one of the symptoms of varicose veins.
Right.
And you know, swelling can be due to a vein problem, but also it can just be age-related. And I may not look that old, but I'm old enough to have leg swelling issues, and so I wear, I mean, these are compression stockings, and they look like socks.
They look like dress socks.
Yeah, and you know, I have a few pairs. I wear them when I know I'm going to be on my feet all day, and I tell my patients the same thing. If you know you're going to be on your feet all day, wear your stockings, and many times they'll say, you know, they do very much help the swelling.
That's a great tip. That's a great tip. Now, we got a question from Molly in Raleigh. She had the vein stripping procedure years ago twice. Now she has recurrent varicose veins. Do you run out of healthy veins?
That's a great question. You know, you can basically take all the veins out of one leg and put them end to end and get you from here to California.
Okay, so
there's a significant network of veins. Now, a lot of those veins are small, but you're not going to run out of veins. Now, what we want to do is keep the major pathways open, and we treat the ones that are not working well. So even though she's had a stripping before, oftentimes there's duplicate systems inside of the leg, or there's a deeper issue that has to be addressed or taken care of.
Okay, and this question is from Andrea in Fayetteville. Have some thick veins close to her ankles. If they burst, what would happen and how could I fix it?
If a vein bursts, a varicose vein can burst and actually be very dramatic. It can bleed, and many times patients will immediately call 911, which is an appropriate thing to do. But often all that is needed in the moment is just some compression. But again, as with Molly, the question before, and Andrea, both of these patients need an ultrasound to find out if there's an underlying problem that can be treated. Not only do you need to treat that lower vein, but we also need to find out if there's an underlying problem that contributes to that. Because treating just this vein alone won't really address the underlying problem. It's kind of like pulling a weed out without getting it by its root.
Okay, this is from Marie and Clayton. Spider veins elevated in an oval pattern, and they rise above the surface. What can you do about them? Do spider veins rise above the surface?
So there's different things that, yes, it can. And there are different things that actually cause varicose veins to start with. A lot of times it's genetic. Your family has had it before you. Members of your family have had it. And there's other lifestyle factors that also increase the risk for varicose veins. Obesity, having babies, long periods of standing on your legs during the course of the day, all of those can cause those kind of situations. A spider vein might be the very start of it, or it may be just a genetic component. A lot of times, if it's asymptomatic, not causing pain, it can be treated with simple sclerotherapy. But if it's causing discomfort, or it's sore to the touch, it's best once again to get that ultrasound to evaluate the underlying issues to make sure, as Seth mentioned a second ago, that you're not just taking care of the leaf of the weed, but you're getting down to the root.
Okay, Ruth from Raleigh, are there any home treatments for spider veins? Anything she can do?
Home treatments, I would not say that I know of any actual home treatments, but again, as Dr. Mendes says, Bobby said, it's a symptom problem. If it's symptomatic, there are some things that can be done. Warm compresses can sometimes help make painful veins feel better. Compression, as we've already talked about, can help make
but nothing
symptoms.
over the counter that you can get that would, yeah. Okay, Lucille from Moore County, what are the symptoms of a blocked stent in the leg following a procedure?
Blocked stent. Well, most of the time, stents are actually placed into the arteries, which is a different part of the circulation. But she does come on to a certain fact, and some people do have deeper problems in the deep veins that actually travel back up towards the abdomen, towards the heart. And sometimes stents are placed into those veins, And if that's the case and it blocks, there's ways to reconstruct or to get through that blockage. And that's what's a big advantage with the Rex Comprehensive Vein Center is we have specialists that can take care of that. So when you come to see any one of us, whether it be myself or Seth or Dr. Powell, when you come to see us, we can get you to the right person within our group that will be able to take care of that major issue.
Great. Okay, thank you very much. Coming up, we're going to be answering more of your questions in Wake County. Give us a call, 919-744-3876. Outside of Wake County, toll free, 877-277-6252. Just email us to rexoncall@rexhealth.com. Stay with us. Welcome back to Rex on Call live on WRAL. You can just call us. Those numbers will be on your screen. We have a lot of questions we want to get to here. So this is from Miss Williams in Durham. Her right leg, she has varicose veins, swelling, and redness. What should she do besides elevation and compression? What's the next step?
That's an excellent question, Kim. When there's redness involved, that raises another question here that we haven't yet talked about on the show, and that is something called thrombophlebitis. One of the problems that having venous insufficiency or reflux or leaky saphenous veins can lead to is something called thrombophlebitis, which is an inflammatory condition, and that can sometimes lead to developing of clot that can ascend towards the groin. So whenever we hear about redness, one thing we always are concerned about is this patient having a blood clot, and so that can be an urgent type of matter.
She needs to go see a doctor.
She needs to call her doctor. But yes, in the meantime, warm compresses, compression, and taking a drug like ibuprofen or Aleve would be helpful in the short term. But she needs to see her doctor.
Absolutely. Okay, this is Angela from Roxborough. What's the difference between varicose and spider veins? Do spider veins develop into varicose veins?
Good question. Not necessarily. There's different types of veins. The spider veins or telangiectasias are tiny little veins, capillary veins, that are actually at the surface of the skin. So they're very close to the skin surface, whereas a varicose vein is a little bit larger and deeper underneath the skin and looks almost like a small worm underneath the skin. And that's the difference between the two. One does not necessarily turn into the other.
Okay, this is from Shelley in Angier. She had varicose vein surgery that's stripping 20 years ago. She's 76 and she has darkening around the ankles in the past 4 or 5 years. What can be done about that darkening?
What the darkening can represent is development over time of further venous insufficiency. And one of the symptoms and signs of that not only are the swelling and the pain that we're talking about, but also some skin changes, darkening of the skin, ulcers of the skin, and the skin can actually begin to break down. So what this patient needs is an ultrasound, again, to look for the underlying problem. Even after stripping 20 years ago, there can be new collateral veins that can develop that can also become leaky and become a new source of venous pooling in the lower leg, leading to those symptoms. And after treatment, many times patients will notice improvement in the skin.
Okay, this is for, okay.
And I'd like to put one more interjection in there.
Yeah.
We've mentioned several times now about getting an ultrasound.
Right.
And I just want to make sure that we stress the importance of an ultrasound just a little bit. We at Rex, at the Rex Vein Comprehensive Center, we have an ICAVL certified lab run by Dr. Wayne Smith that it does a phenomenal job of evaluating these veins. So when you come to our private offices, these, it's still all within the same system, and you're basically being evaluated by an ICAVL certified lab where the quality of the technologist, those that are reading the studies, as well as the quality assurance of the studies are being checked and evaluated. So that when we evaluate your leg, we have a full understanding of the roadmap of your leg and the problems that exist there. And that's what's so important.
Very important to know. Thank you very much. We'll have a final round of questions right after this break. This is Rex on Call. Welcome back. This is Rex on Call. We're taking the final round of questions right now. This is from Gail in Raleigh. Are varicose veins a health problem even if they're not causing pain?
They can be. Sometimes patients may not feel pain because it's not that bad of a vein, but sometimes patients don't feel pain because maybe they're diabetic or maybe they have another reason why they don't feel the pain. But either way, again, if the underlying roadmap shows reflux, it can very well be a health problem. It can lead to potential phlebitis down the line, skin ulcers. It should definitely be looked at and evaluated.
Worth a check for sure.
Especially if they're having leg swelling.
Okay, yeah, and that's actually Kathy wanted to know if vein disease had anything to do with edema or swelling of the veins.
Absolutely, and so some of the symptoms that you can get if you have insufficient veins or your veins aren't working correct: leg swelling, an aching sensation that's deep down within inside of the leg. If it progresses and continues to have a long-standing problem, it gets to be induration and redness of the skin, and then eventually a wound can break down, as what Seth was just mentioning a few minutes ago.
Okay, Lula from Garner, varicose vein removed and came back. What can be done? Has a large one in her left leg, would like to know.
Call your doctor, come in and see us. We need to do an ultrasound. We need to get you in compression stockings, and again, look for the underlying problem and treat it.
And real quick, I think it's important to mention, these procedures can be covered by insurance. There's a procedure you have to follow, though, correct?
Absolutely. And just was mentioned just a few seconds ago, sometimes when you go to the smaller vein clinics, you get the little superficial treatments and they've taken care and they haven't gotten rid of the root of the problem. And that's why it's so important to get down to the root of the issue. But you're right. What the insurance companies would like often to do is a trial period of medical management before moving towards any of these types of procedures. And so that's the reason why we've been stressing so much compression therapy, exercise, leg elevation, and then if that doesn't work, we still have options available for you.
And that can be covered by insurance.
That can be covered by insurance.
Okay,
Absolutely.
Bertha in Hope Mills, spider veins in both legs, bigger than normal. Some look like a big bruise. Can anything be done about that?
Yeah, Bertha, what you need, again, as the common theme is we need to evaluate you. If after doing an ultrasound and looking at the roadmap, we find that there is no significant reflux and it really is just a small spider vein problem, then we have some options. We can do sclerotherapy, which is tiny little needles. We can, sometimes if they're small enough, we can use a laser machine and take care of the spider veins. But first we have to make sure there isn't an underlying issue.
Okay, Rosa from Warren County. At night she lays in bed and her legs feel funny. She has spider veins in her thighs. Does that cause the tingling, funny feeling in her legs?
Not always. Sometimes there's other symptoms that can happen at night. Most of the time, when you have vein issues, when you elevate your legs, those symptoms resolve and start feeling better. So if she's still having difficulty at night with her legs up, there may be some other underlying causes, but we're also happy to help out to figure out what that is.
Okay, we have 30 seconds here. Mary wants to know if it's all right to cut the veins in one leg after a year after having knee replacement.
Under the right circumstances, absolutely. If she has venous insufficiency, even a year after knee replacement, absolutely that's the right thing to do.
Okay, great. That's a good quick answer. So we have time for one more. Should you go see a vein specialist for pain in legs, or should Sir Jones see a heart doctor?
I agree with seeing a vein specialist. If you have leg pain, a good place to start is always with somebody who specializes in treating something in the legs.
Okay, good start. Okay, as always, consult with your physician about any health concerns. And you can call the Rex Comprehensive Vein Center at 1-855-REX-VEIN or find them online at rexhealth.com/vein-center. Okay, give them a call if you have any questions, and thank you so much for your call, and thank you, Dr. Mendes and Dr. Weinreb, for your experts. And our phone